Okay. Hello, I'm Shanae, and I am going to recite the procedure of by doing a tracheostomy care. Okay, first things first, of course, is to verify the patient, verify the client, introduce yourself, and then verify your patient, verify the client, verify the procedure. Make sure you gather all of your equipment, wash your hands, provide privacy, and then you gather you make sure you have the appropriate PPE on. And then you gather all of your supplies, and then you don your gloves, and then you proceed to open up the package. And then when you open up the package, you get with your non-dominant hand, you get the suctioning, and then with your dominant hand, you have the suctioning catheter. And you make sure before you do anything, before you connect the two, you make sure that the pressuring device that you use is not succeeding over 120 millimeters mercury. And then you attach them, and then once you attach them, you then put the catheter and the suctioning in your dominant hand, and in the non-dominant hand you proceed to first lubricate it and lubricate the catheter, and then you I'm sorry, I forgot a major part. You Before you do anything, you make sure you ventilate them with oxygen for a whole entire minute. I forgot that part. And then so you get the normal saline, and when you open up the container, you're gonna pour the normal saline inside of a container, and then you're gonna suction the normal saline to flush out the catheter, and then to moisten it to make it an easier process to enter inside of the trach. And then you enter it in, and you go all the way down until either the client coughs or you feel some kind of resistance. And then once that happens, you pull back a little bit, and then you proceed to suction intermittently. At the same time, you using your non-dominant hand to, in a circular motion, getting the catheter to come out as you suctioning it at the same time, intermittently though. And then after you do that, you suction the catheter with the saline, and you undo it, you discard it. I don't remember if I think you still have the gloves on. You got to. I don't remember changing your gloves. Okay, so then you just to be on the safe side, I would change gloves and get another stir of gloves, because I don't know. I don't remember. I will get some more gloves. And then you get the trach itself. You unscrew it, because at this moment you're trying to clean. I'm trying to remember, do you clean the stoma before or after you clean the trach? We'll go with you clean the trach first. So you clean the trach, and then you take it out, and you dip it into yeah, I was still thinking, I'm sorry. So you clean the trach, you take the trach out. Once you take the trach out, you put it inside the normal saline, and you clean inside the lumen. You use I forgot the name. You make sure you clean inside the lumen and dry it out. And once you do that, You make sure you put it back, placing it following the curvation, the way it's curved. You follow the direction of that, and then you put it in, and you to make sure it's locked, you turn it, and to make sure it's locked. And then after then, you have Q-tips and gauze, and you dip it inside the normal saline, and you clean around the stoma, and you make sure you're doing it in going to the stoma, then going outward. And then after that, you attach the straps to the trach, and then I'm making sure I'm not forgetting anything. Oh yeah, you know, one of the tip is, if they said that if you see any debris while you're cleaning the stoma, to mix half normal saline and peroxide together and clean it like that. But do not don't use peroxide if the stoma look irritated, or if it's red or anything look irritated. And then after then, you hook the ventilator back up to the trach, and you make sure you take off the oh, I'm sorry, I missed a part. So before you do that, you make sure you take the dressings off before you clean the stoma. Take the old dressings off, and then you clean the stoma, and then you apply new dressings. And you're gonna, and when you do that, you use your dominant hand to hold the trach in place, and then you use your non-dominant hand to hold the trach in place, and your dominant hand to actually apply the dressings up under the trach. And then you do the last step, which is to attach the strings. And then I guess that's it. And then you, of course, make sure you give them their call light. You ask them, is everything okay? You discard everything. You wash your hands. You lower the bed to the safety level, and you document your trach care. All right, I hope I got everything.